Bismillahirrahmanirrahim. Assalamu alaikum. A 25-year-old woman, Gravida 1, Para 1, come to the office due to malodorous vaginal discharge for the last 2 weeks. She tried over the counter antifungal without improvement. 4 weeks ago, the patient had a forceps-assisted vaginal birth and with a prolonged second stage of labor. The delivery was complicated by a third-degree laceration, which was repaired with suture and postpartum endometritis, which was treated with intravenous antibiotics. After delivery, vaginal packing was placed for 24 hours to tamponade traumatized vaginal tissue. During the pregnancy, the patient was diagnosed with vulvovaginal candidiasis. Her medical history includes irritable bowel syndrome diagnosed at age 18. She takes no medication. Examination show a small red velvety area on the posterior vaginal wall with foul-smelling brown discharge. Which of the following is the most likely diagnosis in this patient? So this patient is 25-year-old woman, Gravida 1, Para 1, came to the office due to malodorous vaginal discharge. Patient had a forscep-assisted vaginal birth with a prolonged second stage of labor. Delivery was complicated by a third-degree laceration. She having past vaginal infection. Examination show a small red velvety area on the posterior vaginal wall with foul-smelling brown discharge. Based on these hints, the diagnosis of this question is rectovaginal fistula. And here the correct option is choice E, rectovaginal fistula. Obstetric injury is the most common cause of rectovaginal fistula, which may present within the first 2 weeks postpartum. Rectovaginal fistula occur most often after a third or fourth degree laceration, inadequate wound repair or wound breakdown and infection. Rectovaginal fistula occur due to poor intrapartum care and a prolonged second stage of labor, as this patient having, which causes ischemic pressure necrosis of the rectovaginal septum from fetal head compression. Rectovaginal fistula present with incontinence of flatus or fecal material through the vagina, causing a malodorous brown tan discharge. Diagnosis is usually confirmed by visual examination showing dark red, velvety rectal mucosa on the postpartum vaginal wall, on the posterior vaginal wall. Come to the incorrect one, choice A. Anal incontinence. So anal incontinence results from occult sphincter injury, which is obstetric pudendal nerve injury or pelvic floor weakness. Choice B, Crohn's disease. So Crohn's disease may result in multiple perineal fistula and rectovaginal fistula, along with abdominal pain, bloody stool, and weight loss. Choice C, exacerbation of irritable bowel syndrome. So irritable bowel syndrome, patient having constipation and diarrhea. The patient mainly present with a symptom of constipation for some days and symptom of diarrhea for some days. Choice D, incisional abscess. So incisional abscess, the patient having fever, leukocytosis, pain, and etc. Choice F, retained vaginal gauze. So retained vaginal gauze, for example, a retained foreign, for example, object which is gas can cause foul-smelling vaginal discharge. The examination does not show a retained foreign object. Choice G, trichomoniasis. So trichomoniasis present with the yellow-green fruity malodorous vaginal discharge, which is a sexually transmitted infection. Choice H, vesicovaginal fistula. So patient having vesicovaginal fistula, the discharge having the discharge may be clearly vaginal discharge. Thank you.